Welcome to this Limestone Surgery Center informational video. So, you've been scheduled for a colonoscopy at the Limestone Surgery Center. Getting ready starts a few weeks in advance. In this video, we will review what to expect prior to your procedure, the day of your procedure, and the day after your procedure. This is a general overview, so please check with your doctor for specific instructions. Most people think of unpleasant thoughts when hearing the word colonoscopy, but it's not. It's a procedure that enables your doctor to examine your colon or large intestine using an instrument called a colonoscope. Normally, you wouldn't have this procedure unless you're having problems or have hit the big 50. So why are they done? Well, in addition to routine screening, they are done to examine any irregularities such as abdominal pain, rectal bleeding, or changes in bowel habits by checking for polyps as well as colon cancer. The first step of preparation is to be sure that your doctor has good information about you. Your medical history could include things such as past or recent health conditions, allergies, medications, any over-the-counter medications, and vitamins and iron supplements. It's important that the doctor be aware of any past surgeries, especially any past abdominal or pelvic surgery, as these surgeries could leave scar tissue around the colon. For your safety, there are certain things your doctor should know, such as do you take insulin or pills for diabetes? Have you or are you on a blood thinner? Take a moment to review the restrictions listed. You should avoid aspirin, iron, and anti-inflammatory drugs 1 to 2 weeks before the procedure. Tylenol is alright, but be sure to ask your doctor if it's alright for you. Please follow your doctor's instructions regarding the medications you take. Be sure to tell your doctor if you take medication for diabetes or take any blood thinners such as Coumadin, Pradaxa, Plavix, etc. Once you receive your instructions, it's time to go shopping for what you'll need for the next few days. Be sure to bring along your instructions so you know what to drink. 1 or 2 days before, some people are put on a clear liquid diet. Here's a list of things you can drink. Now this is important. Make sure not to ingest any dairy products and especially nothing red or purple. At this point you're thinking, what can I eat? Well, nothing if put on the clear liquid diet. If your doctor does not put you on a clear liquid diet, you still should eat lighter than you normally do a few days before the procedure. Definitely no seeds, nuts, corn, or other forms of roughage, such as lettuce, vegetables, bran cereals, fiber. The less food in your colon, the easier it is to clean it out. Now that you've gotten the supplies you need to begin the process, let's talk about the prep. Most people say that this is the worst part of the procedure. It's the process of cleaning out your colon. Prior to your procedure, the doctor's office will send you paperwork on your prep and how to prepare. You start the prep the day before your procedure. When and how often you'll take it depends on your doctor and which prep they advise you to take. The prep instructions the doctor sends will vary. It could be a cleansing liquid that you drink over many hours or having to take a few pills. Since there are different methods for this, be sure to follow your doctor's specific instruction or else the procedure may be unsatisfactory and might have to be repeated. Here's the hard part. After taking the prep, you will experience the need to go to the bathroom over and over again. So don't worry, it's completely normal. Since you need to stay close to the bathroom, you may want to do the prep at home. Once you have visited the bathroom several times, you may be wondering, how do you know when your colon is clean? The answer? Well, you'll have to look in your toilet. You will notice what comes out becomes a clear or yellow-brown liquid with tiny flecks in it. There should be nothing large or solid. The reason you can't eat or drink is because your doctor might give you something to make you drowsy during the procedure. Food or liquid in your stomach might be dangerous if you vomit, so make sure your stomach, like your colon, is empty. I know you may be hungry or a little uncomfortable at this time, but remember it will be over soon. After the prep, do not eat anything, including gum and candy. If your procedure is the first thing in the morning, do not drink anything after midnight, unless instructed by your doctor. You can drink clear liquids up to 8 hours before your procedure. The time has arrived for you to visit us. Here's what you can expect upon arrival. First, you will check in at the front desk and complete any necessary paperwork. They will need a copy of your insurance card and identification. The receptionist will confirm that you have a driver to take you home. Second, in the waiting room, you will be greeted by a nurse who will take you back to your private patient room. A family member is welcome to join you. After changing into a surgical gown, the staff will start an IV. Then you will be taken to the procedure room. You will be lightly sedated and the procedure will begin. Third, after your procedure is completed, you will be brought back to your private patient room. You should expect to stay about 30 minutes before your driver can take you home. You will be given a drink and a light snack during this time. Before you leave, you will need to expel some gas to make sure everything is working down there. You can expect some cramping or bloating. Your nurse will review discharge instructions and give you a copy. You'll still be drowsy from the medication, so it's important to have your driver available to drive you home. Following your procedure, some things you may encounter are being drowsy for the next 24 hours, cramping and bloating may continue, do not drive for the next 24 hours, eat lightly, and if you have any questions, please call your doctor's office. Please explore our website, www.limestonemed.com, to familiarize yourself with our center and review the patient information page. You will find a variety of helpful information and a checklist of items to remember before you leave home to come to the surgery center. Thank you for watching this Limestone Surgery Center informational video. We look forward to seeing you at the surgery center.